This is a summary about the article Hysterectomy for Benign Gynaecologic Indication. To begin, I will start by saying that what does the hysterectomy? The hysterectomy, surgery to remove a woman's uterus, is one of the most common major surgical procedures performed in Canadian hospitals. The most frequently cited indication for elective hysterectomy in benign gynecology include treatment of number 1, uteriliomas, number 2, abnormal uterine bleeding, number 2, endometriosis, number 4, POP, and number 5, other chronic pelvic pain. A hysterectomy may be necessary in acute circumstances such as hemorrhage or pelvic infection that is refractory to medical management. Hysterectomy can be approached vaginally, laparoscopically, with robotic assistance, or abdominal by laparotomy. The concept of technicity was first introduced in France. The TI in certain French institutes has been reported as up to 90%, meaning 90% of hysterectomies are achieved through a minimal invasive approach. There are several factors to consider in deciding which type of hysterectomy is safest for an individual patient. Can be the size and mobility of the uterus, extent of pelvic pathology and need for treatment, additional surgical procedures required, surgeon training, expertise, facilities, and access to technology too, and patient preference. The comparison of surgical outcome associated with each type of hysterectomy. We have BH versus TLH, shortened operating time. BH versus AH, that is quicker return to normal activity, shorter hospital stay, fewer febrile episodes or unexpected specific infection. LH versus AH, that is quicker return to normal activities, increased rate of lower urinary tract injuries, shorter hospital stays, favorable wound and abdominal wound infections, and fewer febrile episodes or unspecific infection. And we have LH and RH, that we not have a difference. There is the risk of surgical complication higher in patients with endometriosis. LH in the setting of endometriosis may be associated with additional risks of complications. In a series of 112 women with endometriosis who underwent TLH compared to 572 women with other indications. Those with endometriosis experience a longer operating room time. Women with moderate or severe disease had a nearly 4-fold increases risk of operation. Complications such as urethral injury, bowel perforation, pelvic abscess, postoperative fever, and voiding dysfunction. Referral to a high volume surgeon with experience in endometriosis should be considered by mitigating some of the risk.